बोलो आप लोग टाइटल.
Good afternoon, everyone. I am Dr. Shweta Sonone from Department of Oral and Maxillofacial Surgery. I am Associate Professor in the department. So the topic of today's discussion is oral potentially malignant disorders and the oral cancer, their examination and the screening. So slide.
क्या हुआ? चेंज क्यों नहीं हो रहा है?
सर वो स्लाइड चेंज नहीं हो रही है. ठीक है. This topic of discussion is examination and screening of the oral potential malignant disorders and the oral cancer. So why this topic is important to for discussion, because since as an oral surgeon we have come across the patients which are having the lesions in, if they are showing any dysplastic changes, then their chances of malignancy uh, transformation is about 6 to 36%, and therefore there is a need to explore the effective examination and the screening method for the early detection of this condition. So, when you see the statistical analysis which highlights on the rising oral cancer cases in India, then we come to know that in India there are about 77,000 of the new cases, and there are about 52,000 deaths they are reported annually, which is considered as the approximately one fourth of the global incidences, and which is considered as the very deadly worrying condition in front of us. Therefore it is necessary that we should know the how to early detect this condition so as to save the lives of the persons, improve his prognosis and the outcome of the treatment. So but the main concern is that when the patients having these conditions, so they only report in our clinic so when they are having associated pain and the swelling associated with it, and therefore they referred for the early diagnosis and the treatment for this condition. But most of the time when the lesion is present in the oral cavity, and most of the time patient do not have any signs and symptoms related to this condition, so they are most of the time they are neglected by the patient also, because they unaware of these conditions are to be present in the oral cavity, and therefore it is required that the all practitioners should be familiar with the range of the clinical presentation of this condition. Since we are the dentists and the guardians of the oral cavity, then when we come across this condition intraorally, then we should make aware of this condition which is present intraorally. Then what are the various risk factors which responsible to cause this condition? So the patients which are having the deleterious habit, like the patient if having the tobacco chewing habits, they having the alcohol consumption habit, betel nut chewing, so all these are considered as in the risk factors which responsible to cause this condition. And also if the patient are having the HPV infection, it is also considered having some link with associate to cause the oral cancer. So, what are the various types of the these malignant disorders which are present in our oral cavity? So, there are the various conditions which are present. That is, first is a leukoplakia. So, leukoplakia, it is a whitish lesion which is present in oral cavity, which is considered as an the non-scrapable lesion. Then the erythroplakia, which is considered as an the red patches which are present in the oral cavity. Then the oral submucous fibrosis, where you can encounter there is a fibrosis present in the oral mucosa, and there is an inadequate mouth opening or the restricted mouth opening, and the patients having the lichen planus. So these are the various conditions when they are present in the oral cavity, then they are considered as in the oral potentially malignant disorders. So, therefore, to confirm the diagnosis of this condition, the complete clinical conventional examination is very much essential. So, it is recommended that you have to do the proper clinical inspection of the oral cavity to detect this the condition if it is present. And then next is the palpation of this lesion. So you have to palpate the lesion to detect whether there is any indurations or nodules are present associated with lesion or not. And then any suspicious lesion when you are encountered, so for confirmation of the diagnosis, it is required that you have to do the biopsy. Then next, apart from the conventional examination technique, there are the certain advanced imaging techniques. They are also available to detect this condition. So they are the well scope, in which you can do the fluorescence visualization of the dysplastic tissue changes in the oral cavity. Then the toluidine scanning, in which when you applied in the oral cavity, it enhanced the visibility of the lesions. And the optical coherence tomography, this is again technique, so in which you can recognize the depth of the lesion. So after confirmation of the diagnosis, then you come to encounters, then what are the various patients, they are individual present which are having the high risk individuals. So if this when you come to know about the patient, then you plan the routine checkup for these patients. And there are the definitely the community awareness programs need to be employed for the empowering of the patients regarding this condition. So when you do the early detection, successful early detection of this condition, then definitely you can come to early intervention of this condition for the better prognosis of these conditions. But during the management of the condition, there are certain challenges we are encounter and require the further research regarding the treatment for this condition. So how you prevent this condition? So for the prevention of conditions, you ask the patient to do certain lifestyle modifications. So if the patient having certain deleterious habits such as tobacco chewings and betel nut and all the things, so you ask him, so you have to cease all these habits, so do not aggravate the lesion further. And patient asked to maintain his proper oral hygiene, and then you just have to educate the patients regarding how he self examine his oral cavity for detect any lesion of this condition if it is present in the oral cavity. And the patients which are having the high risk population for this conditions, then it is required you have to vaccinate the patient against this HPV infection. So, for the managing of this condition, it is required that the multidisciplinary approach is required. So, along with the oral and maxillofacial efforts, it's required that for addressing the emotional aspect of the patients, it is required you just have to do the psychosocial support for the patients. Then also after giving the proper treatment to the patient post-operatively for improving the quality of the life of patients, proper rehabilitation services is also need to be employed for the patients. So the summary of this presentation, it's the recap key points. That is the meticulous clinical examination need to be carried out, and the clinician need to be familiarized with the clinical presentation of this condition. Then the conventional and various advancing imaging techniques need to be practiced for the detection of these conditions. Regular checkup is needed for the high risk group patients. Community awareness programs need to be employed for awareness of this condition, and education regarding the lifestyle modifications and maintenance of oral hygiene and the self oral examination. Multidisciplinary approach is required to be practiced for the management of these conditions. So the emphasis on the continuous improvement are given for the continuous preventions, diagnosis, and management of this condition. Okay. Thank you very much for your patience listening. Thank you.
Thank you so much, ma'am. Moving towards the next session, as a dental surgeon, we must know the medical emergencies which can occur in our clinic and how to deal with it. So I request Dr. Vandana ma'am to start the session on medical emergencies.
चार्जर लगा ना
Good afternoon, everyone. Today's topic for discussion is management of medical emergencies. As we know, medical emergencies can happen anywhere, anytime, and with anyone. So, as a dental practitioners, we should be always prepared to handle the medical emergencies. In this presentation, there is a detailed information about various medical emergencies, then the precipitating factors of that medical emergencies, what are the prevention and how to deal with the management. So what is medical emergency? Medical emergency in a dental practice is an acute illness that poses an immediate risk to a person's life or on long-term health. It can occur in healthy individual as a response to numerous precipitating factors or due to acute deterioration of pre-existing comorbidity. So medical emergency can involve anyone. That means not only the patient, but accompanying person can have that medical emergency, or even the doctor can have medical emergency, can occur in medical emergency, we have to give, and other staff members also. So it can occur anywhere outside the dental clinic, even after we discharge in patient's home also, there is a chance to occur medical emergency. So what are the precipitating factors which will cause medical emergency? Stress, drugs, age-related factors, pre-existing systemic conditions, and longer appointments. Now stress, whenever the patients coming to the dental clinic, most of the patients, they are having stress, fear, and anxiety. What type of fear? Fear of injection, fear of extraction procedure, fear of the use in our dental practice. तो equipments कौन से हैं? जैसे कि forceps है. When they see the extraction procedures, then they have a fear of that. They have a stress and anxiety. Even we use the drill, because of that drill, they have a fear. Again, what type of stress or anxiety? Because of their previous painful extraction का जो experience है उनका, उसकी वजह से पेशेंट को स्ट्रेस रहता है जब भी वो डेंटल ट्रीटमेंट के लिए आते हैं. या फिर अगर जिनको फर्स्ट टाइम डेंटल ट्रीटमेंट है, उनका स्ट्रेस जो रहेगा, एंजाइटी रहेगी, वो ड्यू टू द फ्रॉम दे गॉट द इंफॉर्मेशन फ्रॉम देयर रिलेटिव और फ्रेंड, तो वो एंटिसिपेटेड प्रोसीजर रहता है जिसकी वजह से उनको फियर है और स्ट्रेस है. सो मोस्ट कॉमन मेडिकल इमरजेंसी related with the stress in dental clinic is the vasodepressor synco. Okay? Then the drugs, the most commonly drugs which we use in the dental clinic, these are for the pain, that is NSAID, and anti-anxiety drugs, and for the infection. So as a clinician, we should have the knowledge, pharmacological knowledge of these drugs to prevent the drug interaction. Agar koi patient hai, they are having a systemic illness and they are taking medicines for that systemic illness, so there is a chances that drug interaction could occur. So we should have a adequate knowledge of that pharmacological action of the drugs we are prescribing, and there is a chance, and the route of administration, we should know adequate knowledge of the route of administration. Otherwise there is a chance of overdose reaction, there is a chance that there is a drug allergy. These are the medical emergencies can occur related with the drugs. ठीक है. Then एज रिलेटेड फैक्टर्स, जो पेशेंट्स हमारे डेंटल क्लिनिक में आते हैं, when the elderly patients reported to our dental clinic above 45 year age, तो ऐसे पेशेंट्स में there is chances of systemic illness. तो systemic illness है तो हमको आइडेंटिफाई करना चाहिए. अगर अंडरलाइंग कॉज सिस्टमिक इलनेस है बट क्लिनिकली पेशेंट को साइन सिम्टम्स नहीं है, ऐसे केसेस में हमको पेशेंट को एंटिसिपेट करना चाहिए कि पेशेंट को सिस्टमिक इलनेस हो सकता है. ठीक है. तो अगर अंडरलाइंग कार्डियक डिसऑर्डर है तो ड्यू टू द स्ट्रेस इन द ट्रीटमेंट और ड्यू टू द फियर, देन ट्रीटमेंट और अरिथमिया and even cardiac arrest if the underlying cause is unnoticed. Pre-existing systemic conditions like if patient is having hyperthyroidism or diabetes mellitus or hypertension, then chances of cardiac arrest. Hyperthyroidism, patient may get the medical emergency. So we should be prepared to handle these conditions. Longer appointments in the dental clinic, the duration of the treatment should be less than 60 minutes. If we increase the treatment, then that more than 1 hour, then the treatment becomes stressful to the patient, to the auxiliary staff, and to the doctor also. So it will cause again if again the patient is medically compromised, then that stress it will cause and pain. If there is a longer treatment and in pain is there, then that will cause the medical emergencies like arrhythmia and anginal pain sort of conditions. So majority of the medical emergencies which occur in the dental clinic are preventable. So how to prevent the medical emergencies? By evaluating the patient. Proper evaluation of patient is very important. So what are the components? First is the medical history. We have to take a proper medical history. Medical history में क्या क्या पूछेंगे patient को? If patient is having any medical disorder, systemic disease, hypertension, hyperthyroidism, या फिर diabetes mellitus, any bleeding disorders, any history of hospitalization, history of cardiac arrest or angina, this type of history we have to take. Then physical evaluation. In physical evaluation, sometimes there is an underlying disease. Sign symptoms is not visible, but there is underlying disease. In that case, physical evaluation is very important. We have to monitor the vitals, that is blood pressure, pulse, heart rate and rhythm, temperature. If there is an infection, we have to check the temperature and height and weight of the patient. Okay? If that means BMI, we should calculate BMI. If the BMI is large, then there is a higher risk of systemic complications patients may have, and there is a chances we can anticipate the complication. So this physical evaluation is very important. In visual inspection, we can visually inspect the patient. What is the how is the physical status of the patient? Visually we can see the stress level of the patient or the anxiety level of the patient, and accordingly we can counsel the patient. ठीक है. Then the body movements, जैसे patients को अगर hyperthyroidism है, Parkinson's है, तो patients को tremors रहेंगे. Posture changes, if there is a posture changes, arthritis patient में तुमको पता चलेगा कि there is a posture change. So visual inspection, कभी कभी patients खुद नहीं बताते हैं, तो हमको बाय फिजिकल इवेल्युएशन एंड विजुअल इंस्पेक्शन वी हैव टू एंटिसिपेट द any illness, and accordingly we have to do the investigations, and then only we can start the treatment according to the, if there is a systemic illness, then we have to modify our treatment protocol. ठीक है. Psychological examination is very important to recognize the anxiety and stress. Anxiety and stress, अब इससे पहले भी बताया है, it will cause, most common is the syncope. Then the risk stratification, it is given in the next slides. Medical consultation, if there is a uncontrolled systemic diseases, then we have to take the physician's opinion. So medical consultation is important in some patients. Stress reduction protocol. We will talk about stress reduction protocol. Stress is the most common factor in the dental clinic. So we have to work on the stress reduction protocol. In stress reduction protocol, first is the pre-medication. Why it is important to reduce the stress? अगर stress है patient को, तो patient क्या है? Anxiety है, तो patient अगर दूसरे दिन treatment करना है, तो patient रात भर सोता नहीं है. अगर patient नहीं सोया, तो then patient is fatigued. So while doing the treatment, patient is not जो pain का stimulus है patient का, वो reduce हो जाता है, तो patient become uncooperative. So we have to reduce the stress of the patient. So evaluation is important. अगर हमको दिखता है कि patient को stress है, anxiety है, तो हमारा पहला काम है कि we have to reduce that stress and anxiety by giving the anti-anxiety medication, that is the pre-medication. ठीक है. Then appointment scheduling. अपॉइंटमेंट शेड्यूलिंग अगेन, अगर पेशेंट रात भर प्रॉपर हमने प्री मेडिकेशन दिया है, स्ट्रेस रिडक्शन प्रोटोकॉल फॉलो किया है, एंटी एंजाइटी ड्रग्स दिए हैं, तो पेशेंट का जो रेस्ट है वो प्रॉपर हुआ है. ठीक है, तो फिर पेशेंट को जो स्ट्रेस है वो कम है एंड पेशेंट विल कोऑपरेट. सो अपॉइंटमेंट शेड्यूलिंग कब करनी है? अर्ली इन द मॉर्निंग. अगर वर्किंग आवर्स के अर्ली मॉर्निंग में हम करेंगे तो पेशेंट को इमीडिएट ट्रीटमेंट है, तो पेशेंट को ज्यादा सोचने के लिए टाइम नहीं मिलेगा कि मेरे क्या ट्रीटमेंट करने वाले हैं, मुझे इंजेक्शन देंगे, मुझे दांत निकालना है तो मुझे दर्द होगा, ये सब सोचने के लिए पेशेंट को ज्यादा टाइम नहीं मिलेगा. तो इन द अर्ली आवर्स ऑफ आवर वर्किंग आवर्स वी हैव टू अपॉइंट द पेशेंट. मिनिमाइज द वेटिंग टाइम. जो वेटिंग टाइम है वहां पे हमको पेशेंट को कम से कम रखना चाहिए, क्योंकि वही फिर वो एंटिसिपेटेड ट्रीटमेंट जो रहेगा उससे, इवन जो क्लिनिक में स्मेल है ड्रग्स की, उसकी वजह से उसका स्ट्रेस लेवल बढ़ता है. सो द वेटिंग टाइम शुड बी मिनिमल. इंट्रा ऑपरेटिव सीडेशन, इट इज नीडेड व्हेन देयर इज अ एडिशनल स्ट्रेस रिडक्शन इज नीडेड. मतलब हमने एंटी एंजाइटी ड्रग्स दिए हैं पर फिर भी हमको लगता है कि पेशेंट इज नॉट cooperating. In that case we have to give the intraoperative sedation. Adequate pain control is important while doing the treatment and also post operatively, and short duration of treatment, ये तो पहले डिस्कस किया है हमने. ठीक है ना. Then risk stratification क्या है? That is the physical status classification. It is given by the American Society of Anesthesiologists. तो इन्होंने जो क्लासिफिकेशन दिया है उसके अकॉर्डिंगली ASA1 में क्या कौन से पेशेंट्स आते हैं? These are the healthy patients. So we can do the treatment of these ASA1 category patients in our dental practice. In ASA2, these are the patients who is having minor systemic illness. So these patients also we can do in our dental practice with proper evaluation. Then ASA3 is the patients having severe systemic illness. So in these patients, there should be, if there is a hospital setting, then only we can admit the patient or we can go for the treatment. And in these patients, according to evaluation, and we have to modify our treatment. In ASA4 and 5, here there is a severe systemic illness. The patient will have a threat to their life. So ऐसे patients में हमको only we will do the conservative treatment, and there is significant treatment modification we will need. Prevention, most important is the prevention of the medical emergency. तो हमको medical emergency आने से पहले हम उसको कैसे प्रिवेंट कर सकते हैं उस पे ज्यादा ध्यान देना चाहिए, ठीक है. When we prepare for an emergency, the emergency ceases to exist. So we should be always prepared for the emergency. What तो हमको क्या है कि उसमें ट्रेनिंग रहना चाहिए बेसिक लाइफ सपोर्ट का. वी शुड हैव अ टीम मैनेजमेंट. हमने टीम बनानी है 1 2 3. तो हमको पता रहना चाहिए कि कौन सी टीम को क्या काम करना है अगर इफ देयर इज अ इमरजेंसी. इमरजेंसी प्रैक्टिस ड्रिल्स, जैसे मैडम ने बताया था, एनेस्थेटिस्ट मैडम ने, कि ये ड्रिल्स हमने करनी चाहिए, नहीं तो हम बहुत टाइम तक कोई इमरजेंसी नहीं आई तो हम भूल सकते हैं. तो ये जो टीम है ये ऐसे इमरजेंसी प्रैक्टिस ड्रिल दे शुड परफॉर्म. What is the duty of team 1 is to provide the basic life support as in team and alert the office staff members that we have done previously. टीम 2 जो मेंबर है उसका क्या है, he or she has to bring the emergency drug kit, oxygen and defibrillator to the emergency site. ठीक है. चेक द ऑक्सीजन डेली. व्हाई इट इज इंपॉर्टेंट टू चेक द ऑक्सीजन? नहीं तो ऐसा होगा कि हमारे पास ऑक्सीजन सिलेंडर है पर वो खाली है, ऐसा नहीं होना चाहिए. तो सो वी हैव टू चेक द अवेलेबिलिटी ऑफ द ऑक्सीजन. चेक इमरजेंसी किट वीकली. इमरजेंसी किट में भी हमको सारे मेडिसिन है क्या, वी हैव टू चेक द एक्सपायरी ऑफ द मेडिसिन. कभी हम यूज करते हैं और उसको रिप्लेस नहीं करते. सो वी हैव टू चेक द इमरजेंसी किट वीकली. Check for the defibrillator weekly. Again we have to charge the defibrillator. ठीक है. It is easy to working or not, that we have to check weekly, because whenever it is necessary it should be available in proper working condition. Team 3, what is the duty of team 3 is to assist with the basic life support, monitor vital signs, prepare emergency drugs for administration, activate the emergency message system, assist as needed and maintain the records, meet rescue team at building entrance and escort to the office. So these are the duties which are given to the team members and these should be followed. Prevention of medical emergencies, this is the there should be a holistic prevention. Wow. How to prevent the medical emergencies? First is the holistic patient evaluation, tailored the treatment plan, effective management of pain and anxiety. This will cause the prevention of these medical emergencies. Emergency medical system call, ये भी मैडम ने बताया था ना. We have to call 108. Now in 108 what information we have to give them? Location of the emergency, give the proper location so that वो जितने जल्दी हो सके वो वहां तक पहुंचे. टेलीफोन नंबर, नेचर ऑफ द इमरजेंसी, कार्डियक अरेस्ट है, हाइपोग्लाइसेमिया है या फिर ट्रॉमा है, दैट टाइप ऑफ नेचर ऑफ इमरजेंसी वी हैव टू एक्सप्लेन. हाउ मेनी पर्सन्स नीड हेल्प, कंडीशन ऑफ द विक्टिम, अनरिस्पॉन्सिव है, अनकॉन्शियस है या ब्रीदिंग चालू है, ये सारा कंडीशन ऑफ द पेशेंट वी हैव टू एक्सप्लेन. what aid is being given to the victim. हमने अपनी तरफ से पेशेंट को क्या क्या किया है, CPR दिया है या फिर use of we have used the defibrillator. That information we have to give to the EMS system so that they will know what else will be required and any other information requested. अगर वहां से फिर वो जो भी information हमको पूछते हैं to give the information. Now emergency drug kit, what are the drugs we should keep in the emergency drug kit? Drug administration is not necessary for the immediate management of the medical emergencies. ड्रग एडमिनिस्ट्रेशन का रोल बाद में आता है. सबसे पहले आता है वी विल स्टार्ट द इमरजेंसी विद द BLS, बेसिक लाइफ सपोर्ट. व्हेन इन डाउट डोंट मेडिकेट. अगर हमको ड्रग्स के बारे में नॉलेज नहीं है तो हमने ड्रग एस्पिरिन, कार्डियक अरेस्ट, glucagon if there is a hypoglycemia, you can know what type of the emergency and accordingly you can give the emergency drugs. Oral glucose also in hypoglycemia. Midazolam, it is given for the when there is when there is a mechanical ventilation is needed, then we have to give this midazolam, and oxygen is always needed. Flumazenil, it is only required when we give the mechanical ventilation. For the reversal of the sedation, we give this flumazenil. इमरजेंसी इक्विपमेंट्स, अभी जो भी हमने यहाँ पे इक्विपमेंट्स यूज किए वो सारे मेडिकल इक्विपमेंट्स है। उसके बाद जो हमको यूज करने चाहिए वो भी बताते हैं। पोर्टेबल ऑक्सीजन सिलेंडर, ऑक्सीजन फेस मास्क विथ ट्यूबिंग, बेसिक सेट ऑफ ओरोफेरेंजियल एयरवेज, ये यहाँ पे नहीं दिखाए थे। एक्चुअली वी शुड हैव अ this oropharyngeal or nasopharyngeal airways, pocket mask with oxygen port, self-inflating bag and mask apparatus with oxygen reservoir and tubing, variety of well-fitting adult and child face mask for attaching to the self-inflating bag, portable suction, appropriate suction catheter, single-use sterile syringes and needles, spacer device for inhaled bronchodilators, automated blood glucose measurement device, and automated external defibrillator. These are the equipments should be available. Assessment of the medical emergencies. Now this we have, this is very well explained by Dr. Bhule sir and Pallavi madam. So I think it is over for today. Thank you for the patient listening.
Vote of thanks बोलो। दावे सर का नहीं, vote of thanks। दावे सर के पूरे सर बोलो नहीं है भी। Vote of thanks। Vote of thanks था ना तेरे में बनाया नहीं। क्या बोलने वाला था vote of thanks? Vote of thanks बोलने है। महक ठीक है। को नहीं पता है आप क्या क्या बताया इसमें? नहीं मैं उनको थैंक यू बस वेरी गुड सेमी कॉन्फिडेंस ऑप्शन।
So moving towards the vote of thanks, it was a wonderful program. So I would like to thank our HOD sir, Dr. Pandilwar sir, and all the staff of the department. Dean sir, Dr. Abhay Datarkar sir, then our HOD sir, Dr. Pandilwar sir, and all the staff from the Department of Oral and Maxillofacial Surgery. Thank you.
And this brings to the end of the program. Thank you very much for patient listening.
This brings to the end of the program. Thank you so much for the patience listening.
Thank you.
Thank you. वो YouTube लाइव बंद किया क्या?
Yes.